Hello, I'm Ronald Head, and these are my notebooks. This is my research notebook. I have all of the included tabs, including vertical subluxation with articles, wellness and development, all the way down to new vitalistic system. This is my standard operating procedure notebook. I have table of contents. I have guidelines for visits 1 through 10, new patient protocol, office visit issues, everything that I need to have included to help begin opening up a running office. Thanks. Hello, Monique. I'm Dr. Ronald. How are you doing?
I'm good. How are you?
Okay, it's good to see you again. How are things going in the field of education?
It's going pretty good. We're getting ready for testing, and so it's kind of hectic.
Okay, hectic, stressful. I understand. I've been there once before, so I kind of know what you're going through. But I'm glad to see you here again. So last time I saw you, we finished up that process, and now you're back to go over your report of findings so we can discuss your examination results. The last time you were here, you were experiencing some headaches that were lasting about 2 to 3 hours, and this has been going on for a duration of about 3 to 4 months.
That's correct.
Okay,
That's
so
correct.
3 to 4 months, and because of this, you were having difficulty at work with your mood. Feelings of frustration and, just pain throughout the day.
Yes.
Correct?
Yes.
Okay. All right. So because you were having these issues, we decided to do some physical examinations, range of motion test, and you also agreed to let us x-ray you.
Correct.
Right?
Yes.
Okay. As I explained earlier about the central nervous system, you have nerves that are going to different components of your body, and those nerves can, affect different areas. So you might be having pain in one area, but the nerve impulse could be coming from a different location and affecting that area as well. So as a chiropractor, we have to look at the whole body to determine, exactly being able to pinpoint where the pain is coming from.
Okay.
So looking at your x-rays, we were able to find areas of subluxations, not just in your cervical area, but in your lumbar area as well. And through looking at the ranges of motion, having you turn your head side to side, and lack of extension and flexion, we were able to pinpoint some of those areas where you actually have nerve compression. Okay, so when the vertebrae actually moves forward, it compresses on the nerve. So just imagine your finger is a nerve, and you take your other two fingers and you start pressing on it ever so slightly. You might not feel an issue as soon as you press down on it, but gradually, day by day, if you start pressing more and more and more, the tip of your finger is going to turn red because of the blood flow is going to stop going towards the area, and that's how the nerve kind of works. So as you're compressing, you're not getting the full signal sent to that area, and you're going to start developing pain. So the pain more than likely didn't just come, from one little movement, one little jerk, one little whatever. It's a duration of occurrences with this happening. So, this can lead to severe pain, and as a chiropractor, I want to help relieve you of that pain.
Okay.
So, that's what we found during the testing. We also found a little bit of high musculature. So, at this clinic, we look at 3 phases of care. The initial phase, we will address whatever your concern is. You said you were having headaches, okay? So we'll look at you and try to determine how to best alleviate your headaches. Then we also have the reconstructive phase, where we look at all areas of your body and say, how can we best get her back into optimum health? And then we have the maintenance care phase, okay? And during the maintenance care, you're not coming in as regularly as you would before, but it's more to maintain the health that you're at. So once we get you up to optimum health, we want to keep you there. You know, we don't want you digressing or going back to anything like that. So if you look at the x-rays that we have right here, it's not that bad. We'll consider this to be phase 1 because we do see some inflammation here, weakness, you know, areas of scar tissue developing, which could cause a little bit of bone degeneration and misplacement of the bone. Okay, so we believe that we can fix that for you. Okay, we can get you back to, you know, being able to go to work with a smile on your face and not holding your head simply because, you know, issues dealing with students. We want you to be happy. A happy teacher makes for a happy student. So there are more than just this one phase, though. There are actually 4 phases, and the fourth phase would actually be like a critical phase where you would be in bad health. You know, you're not going to get there, but you'll be in bad health. Very poor posture. Posture is very important. That's why we try to look at the entire spine, you know, not just the area with you saying, oh, I have headaches, and us just focusing on the cervical area, but we want to look at the entire spine. You know, you see a lot of sick people, you know, they're usually slouched over, or people who are in poor health, you know, if their belly's sticking out, they might be leaning back. We want you to be able to, you know, sit upright and just have good posture in general. Okay? So I just told you, but if we look at the x-rays, you can see a little bit of the inflammation, and this area right here will be slight bone degeneration, but this is what we can work with if you agree to allow me to work with you on that.
Of course.
Okay. So what we want to do is prevent you from progressing further in this phase. You're still in phase 1, but we don't want to see you go to phase 2 or anything like that. Okay? So let's talk about the treatment plan for a second. We would like to see you twice a week for the next 3 months to evaluate your progress. So we have x-rays of you now, and throughout that time, towards the end, we're going to take another x-ray so we can see your pre and post results. Also, we want to address wellness and functional issues. Okay, so as a patient here, we want you to rise to the peak performance that you can be at. We want you to be healthier than you were before you came in. Okay, so we don't want to just address just you saying, this is hurting today, doc, this is hurting today. You know, let's get Monique to where she's not hurting hardly ever. Okay. And that's why posture is such an important thing, as we spoke about earlier. Before I can begin to work with you as a patient, though, all of the patients go through a training seminar. Okay, so it's called a new patient orientation class, and it is mandatory. So we talk about aspects of health that might affect different areas of your body, things like nutrition, working out, exercise, just to build a complete package. You know, we don't want our patients to just be one-dimensional. We want them to be complete images of health, so when they go out in the world, they can be a shining light of what good health is all about. Those classes are held Thursday between 6:30 and 8:30, and I encourage you to bring your friends, family members, whoever you think might benefit from this as well. You know, hopefully they'll look at you and see improvements in your own life and say, you know what, I want some of what Monique has.
Okay.
All right. So we're going to get you down to phase 0. Okay. So now let's talk about the office policies. My office is open from Monday to Friday, from 8 to 7, and Friday from 9 to 5. Between the hours of 2:30 and 1:30, we do take a lunch break. Okay. But if you have to miss a day, or if you have to miss an appointment, we do ask that you call and cancel 24 hours. Give us 24 hours in advance notice, just out of courtesy, you know, so we can work our schedule around it. And we're serious about our patients coming in and trying to stick to their schedule because your health is important to us. So if you miss more than 2 appointments, someone from the office will call you and they'll ask you to come in so we can speak, because this is a contract between us. Your health is important to me, and I know it's important to you. You know, so in order for us to have a good working relationship, we need to be on one accord with one another. So it's important that, you know, I give you my word that I'm going to be here, and that you give me your word that you're going to be here as well.
Okay.
Thanks. So if we can get you committed to coming and receiving the treatment, we want to get you to phase 0, like we said, and try to correct these issues that we see in order for you to go back and make those children the smartest children in the world.
Okay.
Okay. Does that sound good to you?
It does.
Okay, so and on to the financial aspect. We want you to feel when you come to our office that, you know, to prevent any misunderstanding, that we lay out exactly, you know, what you will owe and what we will do prior to us working on you. So you will know, you know, what we're going to do and what it costs before we ever touch you.
Okay.
You know, we believe that's very important to prevent any misunderstandings, and we will only go as far as you tell us that you want us to go. So we'll never do something and then say, well, this is what this costs.
Okay.
You'll always know ahead of time. We believe in providing the highest quality of care for the most reasonable price. You know, so we have payment options. You can choose to pay per office visit, or you can pay monthly.
Okay.
You know, that choice is up to you. So, do you have any questions for me?
Actually, no. I think you've covered everything. Is there anybody that I would maybe? Is there anybody I should contact when I come in, or anybody that I should ask for?
When you come in, there will be a secretary up front. You'll sign your name. And she'll give you and provide you whatever information you need. She'll notify me that you're here, and I'm going to stick to the scheduled appointment time, so you won't be sitting here waiting hours and hours and hours. That's why we take scheduling very seriously. So you can expect, you know, me to be here and to give you the best of me that's possible.
Okay. All right.
Cool.
Yeah.
So I'm glad you agreed to everything. I can't wait to see you for the training so we can get started.
Okay. All right.
Awesome.
Thank you.
Thank you.